Hello and welcome to PSM Speak. The health sector in India that has fallen ill. The health sector is sick, to put it without mincing words. But at the same time, there is a dazzle, the glitter on one side. The health sector in India, health market is robust, and on the other side, it is pathetic. People do not get proper health care, although this is an important sector. In this video, I try to focus on the glitter on one side of the health sector and the other side, the gloomy side, the unethical practices and all. Please watch till the end because this is an important topic. Health, education and food are the things which no democratic government should ignore. And unless we accept the state of affairs, what exactly is now obtaining, we can't effectively demand the changes that are necessary urgently. So let us review how the health sector status in this country. About I should repeat the dazzle or the glitter of the sector. The Indian Brand Equity Foundation, IBEF, says that the health market in India, it quantified by 2016 it was $110 billion, equal to in Indian rupees 7.4 lakh crore, and this has reached to a level of $635 billion today, 2025. That is 54.87 lakh crore, 54 lakh 87,000 crore equivalent. So big is the sector. And the health insurance, you see the figures. As of February 2024, that year, less than a month in the financial year, the gross return premium in the country was 2.63 lakh crore, equal to 32 billion US dollar. Calculating, taking into the account the exchange rate that year, that is the exercise that I have done. So equal to $32 billion. And the medical tourism, the people coming from other countries to India for treatment, medical treatment. The money involved by 2024, the money earned by the sector in terms of dollars, $7.69 billion. And by 2029, this is anticipated to reach a level of $14.31 billion. So big is the business of healthcare. And 634,000 persons, foreign tourists, medical tourism, visited India in 2023. So this is above the benchmark of 500,000, the 5 lakh benchmark to treat any country as a global leader destination for healthcare tourism. So India reached to that level, and the private sector dominates the healthcare in India. 58.1%. Let's say 58% of the hospitals are under the control of the private sector, and 81% of the medical personnel, the professionals in the healthcare, are working under the private sector. Then there are 1.18 million beds, hospital beds, they are in the private sector, and 29,631 ventilators. So fully equipped, the health care sector, the hospitals in the private sector, they just look like five-star hotels, some of the hospitals in India, and those who have money can get the best treatment here, not only in India, Indian rich, but the people coming from other countries are also getting. So that is the strength of our healthcare industry in terms of its commercial strength. But when we look at look from the needs of the people of this country, the doctor population ratio, again given by the IBEF, is 1:1500, whereas the World Health Organization's benchmark is 1:1000. But the government says that we have exceeded this. It says, in reply to a question in the parliament recently, the Minister of State in the Health and Family Welfare said that India already achieved 1.836. In every 836 population, there is one doctor. So it exceeded the norm of the World Health Organization, one doctor in 1,000 persons. But this statistics doesn't seem to be correct to me. There are 13.86 lakh allopathic registered doctors. Together with them, there are also 5.65 lakh Ayurveda, Unani, homeopathy, Siddha, other systems doctors. Together, the figure adds up to 19.51 lakh. Maybe government has taken this figure and 80% of this 19 lakh, which includes not only allopathic doctors but other systems doctors, then it made its own calculation, taking some population number of the given year and then calculated it to be 1:836. But our experience on the ground, we know how long do we need to wait to meet a doctor in an outpatient arrangement in any government hospital or private hospitals, whatever. The experience tells that we do not have adequate number of doctors in this country. Why? Even the Niti Ayog's report amply brings to light the pathetic situation in the country, the lack of access to the poor. The report says 7% of the population fall below poverty line every year. What does 7% mean in India? 10 crore, 100 million persons fall below poverty line, unable to meet the medical expenditure because they cannot go to the government hospitals, and the services, what they experience, inadequate, not suitable to them. Then perforce they have got to go to the private sector and spend so much money despite so many health schemes that the governments provide or claim to be providing. They say we have enough number of doctors, all right, but more in the urban areas than in the rural areas, but more in the private sector than in the public sector. Also, there is concentration. In Maharashtra, Karnataka and Tamil Nadu, 3 states together, apportion 38% of the doctors. So 38% of the doctors in India are in these 3 states. So the regional imbalances, although we have reached to a number and we are giving aggregate figure, but this is the situation. Then what is the amount that the government is spending? 2026, the estimated spending budgeted is 1.9% of the GDP. And look at this figure in comparison with the amount that is being spent elsewhere in the world. World as a whole, the other countries are spending between 5 to 12.5% of their GDP on health sector, whereas ours is 1.9%. That speaks for itself of the neglect of the sector in terms of the money that is required to be spent on the sector. And US, for example, in 2023, we are talking of 2026 in India, 1.9%. In 2023, US spent 16% of its GDP on healthcare. Although the healthcare system in the United States is not enviable, it's not great, We know that. And the OECD countries spent 9.2%. At least the volume of money that they are spending as a percentage of their gross domestic product, I'm talking about. So we are spending so low an amount, much below the world average, much below the United States, much below the OECD countries, much below what the expert commissions like Dr. Srinath Reddy Commission suggested long back, much below the suggestion of the Planning Commission long back. Then how can we improve the health infrastructure to meet the needs of the millions of people in this country? These are the gross national aggregates we are talking about. Then the government is providing health insurance. For example, Ayushman Bharat PM Jan Arogya Yojana, ABPMJ. In a recent survey of one voluntary organization, it was found that 82 persons with disability did not have any health care protection in the country, and 42% of them do not know about the existence of ABPMJ. Although we have schemes like this, the experience of the people, when we made a video on this some time back, on the health care, the newly introduced seniors health care, PMJ for above 70, without regard to their social and economic conditions, and every family getting 5 lakh or so, the details I have given. The complaint is the empaneled hospitals not accepting the scheme. They are turning down those who approach them, people above 70. So they are not getting any benefit out of that. Why seniors? Even other schemes also we have experiences. Let's take the examples of journalists. Some states, the state governments have schemes for them. They have a card. But if they go to the hospital, it's not certain whether that hospital accepts it or not, although it figures in the list empaneled by that government. Why I am taking the example of journalists? Because they are the people with voice. They can complain loud enough to be heard by the government. If that is the situation with them, what about the others for whom the government is giving health insurance facility? So the complaint rate, it is not adequately available. Wherever it is available, it is not properly implemented. Wherever it implemented, the rates that are fixed by the government are not accepted by these hospitals. This is the money that is stipulated by the government for this service, and over and above that, which is not certain that for this service every hospital charges this. No, because this is business. Depending upon that hospital, it charges. There is no certainty, there is no control, there is no regulation. That particular service, particular should be the fee that the hospital should collect. It is not there. And that is the reason why the people, the middle classes, lower middle classes, those who are above poverty line are falling below poverty line. Then the unethical practices. You may have seen in the media the reportage. I'm not giving an exhaustive list of it. Some examples I am giving. Broadly, the treatment is not to the needy. If you have money, paying capacity, some insurance, convenient to the hospitals, private hospitals, they give treatment although you do not have disease. Those who have disease but do not have money do not get treatment. We can't find fault with the private sector because they are doing business. And business is for business. It's not for charity, is their claim. And what other mischiefs that are observed by some, I don't say everybody is doing this, but disturbing is that battery of tests are written whether they are required or not. And one test is marked which is necessary. That marked test, they conduct the test and give the report. For rest of them, I am told that they give a normal report because they are never needed. But they draw the sample, for example, blood sample they take. They use that 1 or 2 drops for a particular test, like let's say CBP, ESR, or something which doctor requires. Then the rest of the blood sample thrown into a sink. So that test, they call it a sink test. That's happening. And the referring, one doctor referring to the other doctor, referrals. There also, the commissions are paid to the doctors who refer to them. Then in India, as you know, the prenatal sex determination, whether boy or girl before birth, no, that's illegal. But these tests are conducted with impunity by some hospitals. Unnecessary surgeries are also conducted. Pharma companies give gifts expensive to the doctors. Even sometimes they arrange even foreign trips to the doctors and their families. And some corporate hospitals give targets to the doctors. Hey doctor, you are paid say 4 lakh rupees a month. Your continuation in the institution is justified only when you bring revenue more than what you get. Then those doctors are forced to write more tests than are required, give treatment which is not necessary, do the surgeries and other procedures that are not necessary, bringing money to the institution through unethical practices. So the healthcare system needs overall reforms to facilitate access to healthcare to everybody in the country. A universal healthcare is required that is possible through the governmental intervention. It should expand the healthcare infrastructure, should control, regulate the private sector, should ensure that the health sector doesn't run on commercial lines. The market forces philosophy shouldn't be applied to healthcare at least. Let's hope the government will focus on this and think of bringing necessary changes as soon as possible. Thank you so much for so patiently watching this video. Please do subscribe to this channel if you haven't done it already. Subscription, as you know, is free, but it means a lot to me. Thank you.